We're reforming non-compete clauses to lift wages by up to $2,500 a year for workers covered by them. We've supported an historic wage increase for the early childhood educators and care workforce. And we've backed pay rises which ensure the national minimum wage has risen by almost $7,500 a year. Speaker, we know that Australians, despite all of this, are still under pressure, and a lot of that pressure is felt at the checkout. That's why we're cracking down on the supermarkets. By empowering the competition watchdog, making the food and grocery code mandatory, increasing penalties and boosting competition. At the same time, we're targeting excessive surcharging and scams and unfair trading practices that harm consumers. Speaker, a university education is a life-changing opportunity, but it shouldn't leave Australians with a lifetime of debt. This year we will cut 20% off all student loan debts, raise the minimum repayment threshold and reduce repayment rates. Combined with our existing student debt relief, we will slash $19 billion in debt for more than 3 million Australians. Speaker, in every budget, including this one, we have made medicines cheaper. Tonight we reduced the maximum price for a PBS script from $31.60 to $25. And pensioners and concession card holders will still pay $7.70 a script because we froze their costs as well. We're also investing $1.8 billion to list more life-changing and life-saving medicines on the PBS. For example, cutting the cost of a lymphoma treatment will save some Australians more than $600,000. Speaker, the Pharmaceutical Benefits Scheme is a great Labor creation and it's a great Australian institution. And we are strengthening it because Australians need us to, not weakening it because American multinationals want us to. A Labor government created Medicare as well, and only Labor governments strengthen it. Tonight we are proud to make the single biggest commitment to Medicare since its creation. A record $8.5 billion to lift bulk billing rates and build our health workforce. Because of this investment, 9 out of 10 GP visits should be fully bulk billed by the end of the decade. More bulk billing will mean less pressure on families. These incentives mean there will be around 4,800 fully bulk billing practices around the country, making it easier to see a doctor and get the care that you need, and saving patients around $860 million a year. This budget also delivers new incentives for doctors to train as GPs, new scholarships for nurses and midwives, and another 50 Medicare urgent care clinics. This is a $644 million investment in this budget to build on the 87 urgent care clinics that we've already opened. 4 in every 5 Australians will live within a 20-minute drive of an urgent care clinic as a consequence. Opening early, closing late, available on weekends, taking pressure off hospitals and emergency departments, and all you need is your Medicare card. Every single state and territory will also get more money for hospitals in this budget, funding that will reduce waiting times. Tonight we're locking in an extra $1.8 billion, taking our total contribution to public hospitals to $33.9 billion next year.